Let's look at the symptoms of menopause. So a lot of women do not actually realize that they are going through the menopause. So to recap from my previous video on understanding menopause, menopause occurs when the ovaries stop producing eggs, your estrogen levels fall, and you eventually stop having periods. Now usually you go through the menopause from your mid-40s to your 50s, however you can go through menopause at any age, especially if you have an underlying medical condition or you're receiving treatment for cancer like chemo or radiotherapy for instance. But usually menopause is due to the natural process of aging, which is inevitable if you're a woman. Mind you, not all women experience symptoms of menopause. So some women might have no symptoms and others might have all the symptoms of menopause. And these symptoms can vary in severity from one woman to the other. In terms of symptoms, you have early menopause and you have late menopause, which I'm going to cover in the video. So let's look at the symptoms. One of the earliest signs that you are going through the menopause are irregular periods. So irregular periods happen because you may not ovulate every month, i.e. your eggs are not being released into the fallopian tube. So due to the hormonal imbalance, where basically you have an imbalance of your estrogen, progesterone and testosterone, you might notice that your periods are shorter, i.e. if your periods usually last for 7 days, they might last for 3 days, or your periods might be longer, i.e. they could last for up to 14 days. You might notice that your periods are heavier or lighter, and you'd also notice that your periods are becoming more frequent, i.e. you're having periods every 14 days, or your periods are becoming further apart. So if you had a period in July, you might not have another period till September, and then you have a period in October, and then you might not have another period till March of the following year. Now, another important menopause symptom, which is probably one of the reasons why most patients come to see the doctor, are hot flushes and night sweats. Now, it's thought that this happens because you have the temperature controlling center in the brain called the hypothalamus, which is responsible for regulating your body temperature, and this hypothalamus becomes more sensitive to any slight change in temperature, so it malfunctions. So women would describe hot flushes as this intense heat that's going throughout their whole body, which might last from a few seconds to a few minutes to a few hours, and it might happen a few times during the day. It is thought to be so intense, and that if you notice at the workplace that your colleagues sitting next to you have got all the fans on while it's freezing cold, then you will suspect that this woman is likely going through the menopause. You also have night sweats. Now, night sweats happen during the night time. It affects your sleep and causes you to feel tired during the day. This can also be accompanied by symptoms of palpitations, where basically your heart starts racing very fast. It is now currently being argued that menopause should be considered a disability simply because hot flushes and night sweats can be so debilitating that it affects your quality of life. However, if you are under the age of 45, I would suggest it's probably a good idea to do blood tests to rule out other causes of night sweats such as thyroid problems, as well as cancers such as leukemia and lymphomas that can also present as symptoms of night sweats. Another symptom of menopause is poor sleep. Now, poor sleep can be due to night sweats or mood changes, as well as the menopause effect. So you might find that you have difficulty falling asleep or waking up frequently during the night, as well as just not having that deep quality sleep that you normally used to have. This can then lead on to the symptoms of fatigue, which, as I mentioned, again is as a result of poor sleep, can also be due to night sweats, and fatigue can also be a symptom of anxiety and depression, which can also present with menopause. This is what we class as mood swings. I mean, naturally, as we get older, we worry about the grandchildren, children, financial worries, you're worried about your pension payments. But this is in addition to the hormonal changes that your body is experiencing. This can lead to you feeling irritable, snappy, especially with close ones such as your husband or children, feeling anxious, low mood, and other symptoms of menopause such as poor concentration and being forgetful. Now, some women with menopause symptoms would also tell you that they've experienced joint pains and muscle aches. Now, joint pains can be common in several areas such as your elbows, shoulders, ankles and wrists, and you might have muscle aches throughout your body. You've been to the doctor, you've had several blood tests and x-rays which are normal, then you can assume that this is most likely due to menopause. Another important element is skin changes. Now, estrogens play a role in the hydration of your skin. So when your estrogen levels are low, you might notice that your skin has a dull luster to it, your complexion might look dull, you might notice that your skin becomes more dry, itchy and scaly. As a result of hormonal imbalance, you might notice that you've got acne-like spots on your face, you bruise easily, and you might have slow wound healing, and this is usually due to reduced collagen production due to lack of estrogen. Also, you might notice hair changes, especially hair loss. Now, naturally, after the age of 40, your hair follicles start to shrink, and this process is accelerated by reduced estrogen levels. So you might have what we call the female pattern of baldness, where you're losing hair at the front and at the temples. You might notice that your hair becomes thin and dry. And some women have excess hair on the chin, which is usually due to increased testosterone levels produced by the ovaries. Now, an important element of menopause, which a lot of people do not actually talk about, is sex. Sexual problems during the menopause. And one of the most common symptoms is vaginal dryness. Now, as we know, estrogen helps to lubricate the vagina. So what happens is with low estrogen, there's reduced blood flow to the tissues of the vagina. So you might notice that the lining of the vagina becomes thinner and drier, which can lead to discomfort during sexual intercourse. The vagina can also become sore, red and itchy, and you might notice symptoms of thrush, which usually is a fungal infection. Also, you can have reduced libido or lack of sex drive as a result of vaginal dryness, and as a result of low estrogen and testosterone levels, which is usually very important for sexual arousal. This is in addition to other symptoms such as stress, low mood and lack of sleep, which can affect your sexual drive. Now, there are other symptoms which you might notice later on in menopause, which are urinary symptoms, such as you might find yourself going to the toilet more frequently than usual, and you have that increased urgency to go to the toilet. And this is because due to the lack of estrogen, your bladder muscles have become quite weak, and therefore you develop an overactive bladder. Estrogen is also important for fighting of bad bacteria, so you might also notice that you're getting more prone to urine infections due to the lack of estrogen. So we've mentioned quite a few symptoms such as irregular periods, hot flushes and night sweats, joint pains, muscle aches, poor sleep, fatigue, lack of concentration, being forgetful, skin changes, hair changes, sexual problems such as vaginal dryness, reduced sex drive, urinary urgency and frequency. And there might be other symptoms that I've not mentioned. I know some women have described having headaches, pins and needles for instance, chest pains. However, it is also important not to assume that all these symptoms are down to menopause, and we usually recommend having yourself checked by the doctors. In some cases, you might need to have blood tests, you might need scans to make sure that there's no underlying symptoms that might be contributing to what you think is menopause. So in my next video, I'll discuss about how and when we should diagnose menopause. So if you know anyone that's going through symptoms of menopause, please share this video, and see you in the next video.